The McKenzie Method refers to a system of management developed by the late Robin McKenzie, a New Zealand physiotherapist. This system is known as Mechanical Diagnosis and Therapy, or MDT.
MDT is an assessment and treatment approach that focuses on the capability of patients to treat themselves. It leaves assumptions and vanities of the clinician aside, which is quite a good thing. And it concentrates on the patient. It's not about what a therapist can, it's about what a patient needs.
The McKenzie Method is not extension protocols. The McKenzie Method is an assessment where you as a clinician are investigating a couple of things. First of all, you're asking the patient through an extensive assessment to give you a picture of what makes them better or makes them worse. You're looking for certain signs and symptoms in their history that might guide you in the direction that they need to move in order to resolve their problem.
The McKenzie Method is a system of examination and evaluation that allows a clinician to make rapid conclusions about the nature of the problem. It also gives us a very accurate predictability in which patients can be helped and in what time frame. This is very important because we certainly do not have the ability to fix all patients, and identifying somebody who is not going to respond is almost as important as identifying somebody who is going to respond.
The hunt for centralization makes me feel like a detective, and the patient is my partner, and we're searching for something together. We must help each other in order that we are not misled by misinterpretation of clues and the evidence that we collect in our investigation. If we truly can't find directional preference or centralization on the first day, then the investigation gets even more involved.
Some manual therapy approaches focus firstly on the application of manual techniques, followed by the provision of supplemental exercises. With MDT, the clinician utilizes primarily self-treatment procedures first, and when necessary, the use of supplemental manual procedures.
The symptomatic as well as the mechanical response to testing is then analyzed, and then we attempt to classify that patient into a syndrome. Each syndrome is characterized, it has a characteristic pattern, and if you're able to identify that pattern through testing, you can then treat that patient based on that classification. Successful treatment is therefore dependent upon successful classification of the patient.
Once you've successfully classified the patients, the hard work is over, as the treatment choice is then predetermined and the response is predicted by the classification. Depending on the classification, patients will either respond quickly, slowly, or not at all.
Most patients will tell you that they have never met or experienced such a rapid response to end-range repeated movement, because a lot of the time the care was passive. We do not use passive modalities such as electrical stimulation or ultrasound. We're trying to be very patient-focused, active, giving the patient the opportunity to fix themselves, and if there's a need, then we jump in with our own overpressure mobilization or manipulation.